The title of this study is Opioid-Associated Pediatric Emergency Department Visits, Limited Morbidity with Opportunity for Prevention. My name is Jennifer Love, and I am a second-year Medical Toxicology Fellow at Oregon Health and Science University and the Oregon Poison Center. In this study, we examine demographics and clinical outcomes in opioid-related pediatric emergency department visits. We performed a prospective study of emergency department visits related to opioid use at a single academic, urban pediatric emergency department from September 2018 to July 2020. Using the electronic medical record, ED providers were asked, "Do you think opioid use was a significant factor leading to today's ED visit?" And a yes/no response was recorded in the medical chart. Records were reviewed for relevant data elements by 2 study members, and descriptive statistics were performed using Microsoft Excel. Over 23 months, emergency medicine clinicians identified 78 pediatric ED visits as related to opioid use. 38 visits had a documented opioid exposure in the chart. 79% of patients were aged 12 plus years old, and 18% were aged 0 to 2 years old. In 95% of visits, opioid exposure was known by clinicians prior to or at the start of the visit. Urine drug screens were ordered in 24% of visits. Oxycodone was the most frequently reported opioid at 47%. In 42% of visits, the opioid was a prescription for another patient. An ED social work evaluation was performed in less than 50% of visits. Naloxone was prescribed at discharge in only 1 visit. Overall, most patients were discharged and there were no associated fatalities. In conclusion, most pediatric patients with opioid-related ED visits were adolescents, with a smaller number of accidental exposures in toddlers. Almost half of the visits were related to oxycodone exposure, and only 10% of visits were related to buprenorphine exposure. Most patients were discharged from the emergency department. While most pediatric emergency department visits related to opioids have low associated morbidity, infrequent social work consultation and low naloxone prescribing rates by clinicians reveal missed opportunities for parent education on opioid safety and the prevention of future opioid-related ED visits. Future efforts around pediatric opioid-related ED visits might focus on increasing naloxone prescribing among pediatric emergency medicine clinicians, or more closely integrating social work teams to provide safety devices, such as medication lockboxes.